Reserve.
Gentleman reserves. Gentleman from California is recognized.
Mr. Speaker, I'd like to yield 3 minutes to my good friend and the author of this bill, the gentlewoman from Ohio, Ms. Kaptur.
Gentleman from Ohio is recognized.
I want to thank the ranking member, Takano, for your great support and for yielding me the time. And I want to thank Chairman Rowe very much for moving this bill through your committee. H.R. 2787, the Vet MD Act, also called the Veterans Specific Education for Tomorrow's Health Professionals Act, and I'm honored to speak on its behalf this evening. The Vet MD Act works to break down barriers and expand opportunities for healthcare professionals to get training to care for our veterans. The bill creates a 3-year pilot program for pre-health undergraduate students to gain clinical observation experience within at least 5 VA medical centers. Health schools recommend or require clinical observation hours, but there is no formal process to apply for these hours. Opportunities to shadow are limited and are based on where you go to school or who you know. And students who attend schools outside major cities, as well as those whose families lack connections to the medical community, find it harder and harder to shadow and are thus disadvantaged in medical school admissions. This places an unfair burden on otherwise qualified students who come from less affluent communities or rural areas. Several years ago, 2 pre-medical undergraduate students highlighted to my team the struggles disadvantaged minority and other young people who lack personal connections face as they apply for medical school. So I'd like to thank Seamus Carragher and Andrew Frank for bringing this serious omission to our attention, and I'd like to thank Carrie Swope, my legislative assistant on this important issue, for her work throughout. Through their own struggle, these students struggled to gain access to clinical observation experience so critical in medical circles, and they realized an immense opportunity was missing. The bill prioritizes students in medically underserved areas, first-generation college students, of which I was one, students referred by minority-serving institutions, and, of course, veterans. The Vet MD Act creates a pipeline for future physicians and medical professionals and prioritizes training for students who specialize in a health profession where there's a serious staffing shortage. This important step will help narrow the gap and ensure we are training pre-health students in careers that are in demand and necessary. And I can tell you, in every hospital system I represent, there's an unmet demand. Thousands and thousands of individuals are needed. Might I have an additional 45 seconds?
I yield an additional 45 seconds.
Without objection, the gentlelady is recognized.
Importantly, pre-health students in the pilot will gain a deeper understanding of veteran-specific health needs and experience, which is critical for health professionals who treat veterans, many of whom have complex conditions, as the chair and ranking member know. One of our top responsibilities as a Congress is to ensure that our veterans, those who have sacrificed so much for our country and for liberty's cause, receive high-quality health care from highly trained health professionals. And this bill furthers that effort, and I'm pleased it will get a vote this evening, and I would like to thank my colleagues, Mr. Nakano, for his diligent work on this bill, and Ranking Member Waltz and Chairman Rowe for bringing this bill to the floor so expeditiously. On behalf of our health professionals, our veterans, myself, and all the co-sponsors, I can't thank you both enough. And I yield back my remaining time.
Gentlelady yields. The gentleman